How can I reverse scoliosis naturally? When consulting with patients, the most common question I get asked is, can we reverse or reduce to scoliosis? And when we look at scoliosis, we know scoliosis is an unnatural sideways curvature of the spine, meaning that there is a curve of the spine and it also needs to have some rotation or some twist. And the rotation is typically into the concavity of the curve. When people talk about reversing scoliosis, sometimes they mean cure, like, can you cure scoliosis and totally remove it from my body? Well, there's a couple things we have to understand about scoliosis. Scoliosis is a progressive condition. That makes it almost incurable. And the majority of scoliosis is also something called idiopathic. Idiopathic means we don't know what's causing it. So since we don't know what's causing it, and we also know it's progressive, most or the majority of scoliosis is not curable. There's no way of curing it. Now, people could have curves in their spine, but they don't have true scoliosis, meaning they have a postural scoliosis. And sometimes those cases can be totally resolved, but it's not true scoliosis because those cases won't have a twist associated with it. Scoliosis that's progressive means the curve will worsen over time, and it's in its very nature. And it will worsen over time in two main times, normally during growth, during adolescent growth, or in later stage life as a result of gravity or compression over time. These unnatural curvatures increase over time, and as the curves increase, the conditions affect also increase. Scoliosis also range wildly in severity from mild to moderate, moderate to severe, and severe to very severe. Even scoliosis that are diagnosed as mild can become severe over time. Just where a scoliosis is diagnosed at the time of diagnosis that has no relevance to where it could possibly become over time. Meaning all these curves progress. Severe curves were once moderate, and moderate curves were once mild. These things progress. So when we look at natural treatment for scoliosis, in most cases people look at natural, meaning non-surgical treatment. It's not relying on the use of prescription medications or injections. They're looking at things that work more in tune with the body's natural healing abilities. In my conservative treatment approach, we offer a less invasive, more natural, non-surgical treatment options that can move people away from needing medications to deal with pain or any kind of problems they have as a result of scoliosis, and also moving people away from having spinal fusion. Now, this type of surgery is what the most common way to do patients are treated with scoliosis is spinal fusion. This is the most common surgery. Now, spinal fusion is a lengthy, costly, invasive procedure. It literally involves fusing the spine together. It is taking bones that are supposed to move and be flexible, joints that are designed to actually function as movable joints, and fusing them and eliminating all movement, therefore fusing the spine into a solid bone. And this is in hope to eliminate progression. Now, the problem is it may eliminate progression in that one area, but since they can't fuse the entire spine together, the curves unfortunately can still progress outside of the fusion. Fusion literally costs the spine in function. It is a non-functional approach. It's kind of like the way I like to explain it. It's kind of like you have an elbow problem, and in trying to deal with the elbow problem, it's kind of like getting your arm, fusing it together, making your arm perfectly straight. You can no longer bend your elbow, move your elbow, and now say you have a healthier arm. Your arm is straight, but you can't move it or bend it or do what it was designed to do. And that's exactly what spinal fusion of scoliosis is. It takes the spine, fuses it into one solid bone, and it can no longer move or bend anymore. Now, conservative treatment is the exact opposite of that. Conservative treatment, especially my type of conservative treatment, is a very functional approach. We want to try to retain as much function as possible, and by meaning so, we want the spine to be also as straight as possible, but with the ability to move and function like the initial design was to be. And normal conservative approaches tend to be more proactive, meaning treating curves much earlier in the diagnosis time, because we know the sooner that we treat curves, meaning the smaller the curve is, the straighter the spine is going to be at the end of treatment, as opposed to letting curves progress over time. And as they progress, they become more difficult to treat, and we're going to have not as small of a curve over time, because we can only reduce curves a percentage of their size. And this is also true for surgical and non-surgical approaches, meaning a 50-degree curve we'll get to maybe 50% reduction down to 25 degrees. But if we let a curve progress to 100 degrees and say we get the same percentage reduction, which we normally don't, we will only get to a curve to 50 degrees. So treating curves at a smaller curve size, meaning we'll always end up with a smaller curve when we're done because we're catching the curve sooner. Conservative treatment is also a customized treatment plan around the patient's conditions and their ability to function properly. Surgery is fusing the spine. It's just taking the spine and fusing together. Where conservative treatment, we integrate multiple forms of treatments to impact the scoliosis on many, many different levels. Chiropractic care can impact the scoliosis on a structural level by adjusting and using a structural approach to try to get the spine back into a better alignment. Physical therapy can also increase strength, but we understand the physical therapy that we use is structural therapy, not just strength-based therapy. So the physical therapy is also designed to help impact the structure of the spine. We use corrective bracing to help augment what we just mentioned, to help push the spine into a corrected position. We're not using traditional bracing that's just trying to slow down progression. And then we're using all this, we also customize home exercises to further stabilize and rehabilitate the spine. Now, when we look at natural treatment, sometimes people think of natural as that I'm just going to try stuff at home. I'm going to try to do some home treatment for my scoliosis. Well, scoliosis is a structural condition, meaning that we have to know the structure of the spine to prescribe all the things I mentioned in the correct manner to influence the structure of the scoliosis. Using traditional types of therapies or exercises or general exercises to make your body stronger necessarily doesn't mean your curve is not going to progress. In fact, my average adolescent patient is normally a 12, 13-year-old girl who's an avid gymnast or dancer, and they're normally extremely fit. And the fitness, it's not that they have a lack of fitness level that's causing their curve. It is their curve is progressing for an unknown reason. It's normally because of growth, that whatever caused it happened, and then as they're growing, the growth itself is what's leading to the progression. So there's very little things you can do to augment or to reduce the curve while they're growing if you're not dealing with the curve on a structural level. In addition, you need x-rays to assess the size of the curve and to monitor the curve over time to see if the curve is progressing. So just looking at your posture is not always telling you exactly when your curve is progressing. In fact, what tends to happen is the curve progresses, then the posture changes. The curve progresses, then the posture changes. It's not like their posture gets worse and then their curve progresses. It's the other way around. So without proper x-ray assessment, you can't know whether your curve is progressing or not, making it more complex to treat and also wasting valuable time. Because like I mentioned, the sooner we treat a curve, the smaller we treat curves, the better outcome we always get. We know smaller curves always respond better, younger patients always respond better. So therefore, just wasting this valuable time can lead to a negative outcome. So we know scoliosis is a structural, progressive, and in most cases, idiopathic condition that requires a very specific approach to help manage and reduce that person's scoliosis. And as a result, most curves are very unique in nature, meaning that no two curves are exactly the same, and therefore no two patients receive the exact same treatment process. The treatment program is very specific for that unique patient. Scoliosis Reduction Center, we offer patients a much less invasive, a more natural form of treatment for scoliosis that moves people away from surgery and medications and injections and helps preserve function of the spine. So not only you can have the benefits now, but also get the benefits of having a functional spine for the rest of your life. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.